Hi, good afternoon. My name is Stephanie Cruz, and I'm a licensed mental health therapist at Sunbeam Mental Care. Because May is Mental Health Awareness, we have been preparing some of videos talking about common phrases that sometimes people use or we use regarding mental health, and might not be the best because of how it sounds or the intention and like how people say it to others. Um, and the phrase that we're going to discuss today is when people talk about, oh, if you have a mental health condition, it's because you're weak, because you're not strong enough, because um, you don't know how to overcome things in life. And that's not true. um, Mental health, having a mental health condition doesn't mean that we are weak. Or even having emotions doesn't mean that we're weak. It just means that we're human beings. And that, yes, we do have feelings, we have emotional reactions to circumstances that we live. Sometimes it can be a little bit more intense than other times, depending on our life stage. Maybe there has been moments when it has been easier to overcome some challenges, and in other moments, because of different factors, it has been a little bit more difficult. It's not about weakness or strength. It's just about the fact that we are human beings. And the idea of making some people feel like they're not strong enough to stabilize or to overcome their symptoms can be really can be really mean. um so how to address this, like how to talk about this. um I have seen that in reality, the people that come, let's say, to therapy, the people that have given me the privilege to listen to their stories, are the most resilient people that I have met. Because even though they have been through maybe very difficult circumstances, they still have the courage and the strength to find resources, to learn coping skills, to try to find new strategies on how to take care of themselves and how to stabilize and how to um, reach their goals. Um, and what can we say about that? And it's that they're really courageous. They have a lot of strength in within them. So um, every time that we talk about mental health, let's not see it as weakness. Let's see it as just part of us, part of who we are. And let's just be mindful and respectful, because maybe something that is being really difficult for someone right now, and maybe we don't understand. Maybe we think like, oh, but I went through something similar and I was able to overcome that easier. Yes, could have been possible, but we don't know the other factors. We don't know what are some other variables that are impacting the emotional reaction of that person. Maybe you go through another experience that feels really challenging, and then you're at a point where you do feel that you cannot handle it all, and maybe that other person was able to deal with it, let's say, in a easier way. So let's just be mindful and not judge other people, because each person is different. And what we need to focus on is on respecting each other's emotions, each other's pain, and also understanding that it's just part of like our life, development and the different stages we go through. So let's not see mental health as weakness. It's not even a situation of strength or weakness, anything like that. It's just an area that we need to take care of, same as we take care of our physical health. um, Something to pay attention to. Maybe if we're experiencing something different, to pay attention to that, to recognize maybe what's impacting our well-being, and then finding the resources and the support that we need, um, to feel better and to get better. And let's also be compassionate with other people and not just label as someone as weak. Let's try to be understanding. Let's try to be respectful, and let's do this together. Hoping that we can build a strong community, really aware, and considering the mental health as a good thing to talk about. So thank you so much for listening, and I hope you have a great day.